let's go ahead and get started today. You are joining us for a brilliant webinar. In the next hour, we're going to be talking about building cross-sector relationships and curriculum to support infection prevention and control in and out of the classroom. Today is April 28, 2025, especially if you're watching our recording later on, you'll know what time of day it is that we're having this conversation. This webinar is brought to you by NNPHI, the National Networks of Public Health Institutes, and is supported by Health Communications Consultants, Inc., HCC, Inc. Now, in this webinar, we have quite a few things that we'd like to achieve. First, we're going to be exploring how cross-sector partnerships can enhance infection prevention and control, IPC education and practice. So the IPC acronym I'm going to be using throughout the rest of the presentation. We're going to help shape the future of public health training and empower the next generation of professionals in IPC roles. And we're going to network, collaborate, and learn from and with our multi-sector colleagues. So I'm so glad you're joining us today. It's going to be such a great conversation. Now, your guides in this workshop are Dr. Sarah Matthews, Dr. Patricia Brockman, and Dr. Danielle Landis. You'll see us throughout the webinar and in the workshop that's planned for you in May, part 2. So stay tuned for that. We'd like to continue our engagement with you. You've already learned how to use the chat feature, but we want you to go ahead and type in the word WOW or abbreviate it with a W. If you hear something that resonates with you, or it's an aha moment, or you're like, you know what, I've got to remember that, go ahead and stick that in the chat, that W or that WOW. Feel free to use the emoji cons whenever there's a conversation happening, or the reaction buttons. We want you engaged. And we know with all of the great information that we're going to be sharing, you might have some questions. So go ahead and put those questions in the Q&A feature. Don't worry about formatting, not to worry about spelling. We're really informal here. We just want the conversation to happen. But put those in the Q&A box and we'll keep them safe for you until the Q&A session at the conclusion of this program. So now that you know how to engage with us, we have so many resources for you. The first one is this workshop guide. Hopefully you've had an opportunity to download it in the attendee hub or on the shared network. But if not, Dr. Brockman is going to enter that into the chat and you can go ahead and download it right now and use the workbook for us to help facilitate our engagement in the exercises and the application of the systems thinking process. Also in there is all of our bios. We're not going to take some time to talk through that, but we have it all there to tell you about our expertise and to network and collaborate with us. So go ahead and download that workbook if you haven't had the chance, or at least look for it where it's stored on that shared drive. And speaking about that shared drive, we've got that linked here for you as well as in the attendee hub. Or if you can't access that, we've also put a QR code that's on your screen. Use your smart device and it'll link you right to that shared resource page. In addition to those curated resources that we have for you, NNPHI has a website that's chock full of resources that we want you to tap into, as well as the Centers of Disease Control Project First Line Portfolio, lots of things there, as well as our partners at APEC, the Association for Professionals in Infection Control and Epidemiology. Our partners there have so many resources for you that we'd like you to tap into as well. And we're going to be talking about a few of those in just a few minutes. In addition to those chock full of resources, we have some beautiful exercises for you. And I'm going to turn the program over to Dr. Danielle Landis to help us recenter and refocus. Danielle.
Thank you, Dr. Matthews. Everyone, thank you so much for being here. We're so grateful to you and for you because we recognize that one of your most precious assets is your attention. And so what we're going to try to do here very briefly is we're going to try to bring to center your attention and then your intentions. So what we're going to do is slow down a little bit, become a little bit more mindful, and then we're going to move into some intentions. So if everybody can breathe with me, we're going to start with a breath of 4 and we're going to hold it, and then we're going to exhale for a breath of 4. So let's everybody slow down a little bit and inhale for 4, 2, 3, 4. Hold it for 1 and then exhale, 3, 2, 1. Letting everybody calm down a little bit. We recognize you have so many things that you're doing right now, so many things that you could be doing other than being here. So we want to bring that back into center. Next, if I can have you breathe in again, and just take a look around the room. Bring your focus to yourself, to your environment. Feel yourself kind of in your chair. Maybe look up at the ceiling, look down at the floor. You probably haven't done that for a while. And then feel what it feels like to be in the room and listen to the background, listen to what's going on outside or down the hall. Give yourself a little bit of a shake to remind yourself where you are in this present moment. And then let's all take another deep breath and remind ourselves that we go in the direction that we think. And so right now, we really want to be thinking about what our presenters are saying, but especially about what we want to do with what they're saying and the things that we're talking about. So let's take one more deep breath. And then when you exhale, think about why you're here. Think about what you want to get from this wonderful panel discussion, from the time and energy that everybody's spending here together. And then if you can just jot them down in your workbook. Why are you here? What are your intentions for this time that we're going to be spending together? And so let's give you just about 30 seconds to do that. Focus on your breathing as you're doing it. And then in about 20 seconds, Sarah will come back on again and move us through the rest of the program.
Thank you, Danielle, for that beautiful recentering and refocus tool. Know that you have this tool now at your disposal. Use it throughout the rest of your day, as well as within your practice. We know that when you give intention, it aligns with our purpose, which ultimately leads to our well-being. So we want that for each and every one of you. We have a few objectives that we're going to achieve today as we speak with each other. During the session and the follow-up workshop, we will together describe the current landscape of IPC content in schools of public health. We are going to understand the cross-sector partnership used by Indiana University, the Association for Professionals in Infection Control, APEC, and the University of South Florida, USF, and how they drive collaboration. We're going to recognize key strategies for building and sustaining effective cross-sector partnerships in our own work. And we're going to apply lessons from Indiana University, APEC, and USF's experience to strengthen or develop our partnerships within your own organization or your sector. So to get us started in this very important discussion is Madeline Gustafson, Program Manager at NNPHI's Climate Crisis Preparedness. Now, all of the reports that Maddie is going to be talking about are on that shared drive, and we have a QR code right there for you. I'm going to turn the program over to Maddie to get us through that description of the landscape. Maddie?
Thank you so much, Dr. Matthews. Again, yes, I'm Maddie Gustafson, Program Manager at NNPHI. And I'm really excited to introduce to you all the Project First Line project that we've been working on for the past few years. So Project First Line is CDC's national training collaborative designed to provide essential infection control education and training resources to healthcare workers and public health professionals across the country. This project has had a pretty impressive reach over the last few years with different educational trainings, different training materials and events, engagement opportunities for both healthcare and public health. Our partners span healthcare, public health, and academic institutions, all working together to build a strong foundation of infection control knowledge and practice. So I'll be diving into the few reports, like Sarah had mentioned, of the project first line work completed to date, specifically around the work supporting infection prevention and control education in schools of public health. So the Association of Professionals in Infection Prevention and Control and Epidemiology, or APIC, report provided recommendations to strengthen infection control education and training. And then health communications consultants with the support of HCC, the Essentials report identified the essential skills and training needs for infection prevention, healthcare associated infections, and antimicrobial resistance. And then with the support of University of South Florida, completed a Masters of Public Health feasibility study focused on the building the capacity of the public health workforce. And then with the support of the University of Indiana's Fairbanks School of Public Health, developed work to build the Masters of Public Health curriculum that supports infection prevention and education. Each of these projects contributed to a strengthening of IPC education across healthcare and the public health workforce. So I'll take a little bit of time to go through each of these reports, starting with the APIC report. There was an environmental scan conducted of IPC programs, serving program directors, infection preventionists, and stakeholders, and assessing really the training needs, hiring challenges, and curriculum gaps. It was found that the IPC specific academic programs were limited, but most professionals entering the field through on-the-job training, often from nursing or microbiology backgrounds. The report found a high demand for IPC workers, with COVID-19 exposing gaps in the workforce readiness. Recommendations from this report included creating a formal academic pathways, increasing career awareness, expanding internship and mentorship opportunities, and strengthening partnerships between schools, healthcare, and professional organizations. For the Essentials report, this outlines the essential skills for infection prevention and control within the public health workforce. It identifies transferable skills, performance objectives, and essential values and attitudes critical for public health success. The report provides a training framework with actionable recommendations for the workforce development, emphasizing emotional intelligence-based training and scenario-based learning to enhance practical application and interpersonal skills. The report highlights strategies to strengthen IPC expertise through blended training, mentorship, and career pathways. It also recommends using recruitment tools to assess both essential skills and technical expertise, and emphasizes interdisciplinary collaboration to bridge public health and healthcare. For the University of South Florida report, this study examines the challenges and opportunities to improve infection prevention and control education and training for MPH students. Methods for this included reviewing existing IPC academic programs, analyzing syllabi from Masters of Public Health programs nationwide, and conducting surveys and discussions with public health graduates and instructors. Key findings included limited IPC-specific programs and a lack of career pathways for infection preventionists in public health. A key recommendation included integrating IPC into core MPH courses, developing healthcare partnerships for internships, aligning the certification requirements, and expanding virtual and experimental learning. I also want to note that the templates and instructor primers are also on the shared drive, as Dr. Matthews had mentioned earlier. So for Indiana University, this focuses on integrating IPC training into Masters of Public Health programs. Key components included incorporating IPC across health policy, environmental health, and social behavioral health courses. The curriculum provides a roadmap for public health schools to enhance IPC education with an emphasis on health disparities and workforce development. It also examines job placement trends for Masters of Public Health graduates in healthcare settings. The curriculum focuses on hands-on training, digital learning, and workforce preparedness with a centralized faculty resource and training videos from hospital settings. Looking to the future of MPH programs, this report includes roadmaps for schools of public health with leadership support for IPC training, establishing hospital partnerships for internship opportunities, and interdisciplinary collaboration. This also included a unique, innovative use of VR training that simulates hand hygiene, PPE use, and contamination risk to strengthen the public health workforce and improve infection prevention and control competency. I'm excited to pass it back to Dr. Sarah Matthews to introduce our expert panel that has been engaged in our NMPHI Project for Sign work.
Thank you, Maddie, for that very brief overview of all the amazing information that are contained in these reports. I know that we are very excited to be able to tap into all of the innovation that's within the reports, the templates, and the primers, and we've got those subject matter experts to talk to us about some of the resources that are in there. But one of the things that we saw throughout those reports is a consistent conversation about collaboration. And we really want to tap in with our subject matter experts on this panel to discuss that collaboration. And with us today, we've got Shandy Dirth from Indiana University. We've got Letty Klutz from the Association for Professionals in Infection Control and Epidemiology, our APEC friends, and Dr. Christine McGuire-Wolf from the University of South Florida. Welcome to the webinar. Let's get started with Shandy first. And I'm going to ask the first question, but also put up a slide that kind of has an abbreviation for all of us visual learners to see. Shandy, get us started. Discuss and come to a consensus on what are the 3 key steps in successful academic practice collaboration.
Thank you, Dr. Matthews. I would say my answer I'm going to share is something we would follow with any kind of project management we do. But the first critical step is to make sure that we understand the needs of both partners. So on the academic side, we might have needs for our students to have so many of contact hours at the hospital setting, or we might need to have certain reports done for accreditation, that sort of thing. Our hospital partners do not live in that world, so we have to be very upfront and intentional in explaining our needs at the beginning of the process. Same thing on the hospital side. The hospitals need to let us know what they're looking for in a student that they will bring on site who could potentially be around patients. One thing that we've been very transparent about is when we bring in our MPH students into this program, they might not have any clinical background. Maybe they've never actually even stepped inside of a hospital before. So we've had to work on that to prepare them to be around patients, to see blood, to see the sort of things you might see in a hospital setting. And then another thing is we really need to make sure we've got buy-in from leadership on both sides. So for the academic side, we all know that we typically want a minimum number of students per class to make it a good financial decision to offer a course, but it might take a few years to really build that into a solid curriculum. And so we need leadership on the academic side to understand this is an investment in the community, not just within the university setting. And same thing for the hospital side. We need them to understand that these students might not choose to go work at that hospital right at graduation. Maybe they're going to float around to some other settings. Maybe they might eventually end up in that hospital. But in the long term, this is an investment in the community. My third main point is we really need to make sure we're documenting challenges and successes for future work. So I remind all of our academic partners that our IP partners in the hospital settings here in our city, they often talk to one another. They see each other in APIC chapter meetings, that sort of thing. And if we were to have a big problem with the program, the word would quickly spread. So we need to make sure we're very reactive. We work well with our partners. We fix any problems that we're having and that we document that. And then if we document that, that's great marketing material that we can use going forward as we try and expand the program.
Brilliant. Thank you, Shandy. Letty, can you add to the conversation?
Good morning, everyone. So I think what Shandy shared is I couldn't agree more with that. And so for context purposes, I'm coming from it from the association standpoint. And Maddie talked a little bit about this environmental scan that was done in 2021, if I remember correctly. And so one of the things that we were very intentional about when we created these guidelines is we wanted to make it easy. And so that was the ultimate goal. And these guidelines really are a template, and they're a template for universities to follow. You know, Shandy talked about this when she was talking about understanding the needs and the requirements of each partner, is that we want to make sure that we're preparing students to be successful in the workplace. And so one of the things and one of the impetuses for creating these guidelines is what we discovered in that environmental scan, the lack of consistency across topics and content that are covered in IPC programs, the need to develop the future workforce. I mean, I think everyone on this call probably can understand and appreciate the aging workforce that we find ourselves in. We really want to make sure that we are uplifting and providing a true entryway for students to select and decide that they want a career in infection prevention and control versus being voluntold, which is a lot of how our professionals, infection preventionists, have found themselves practicing IPC. So that was something that we wanted to make sure that we were doing. And then it's so important to have leadership buy-in, to have people behind you that are supporting you, that understand the value of the program that you are putting forward. So that's what I have to add on to what Shandy had said thus far.
Thank you so much, Letty. I definitely resonated with some of those points, having worked in both areas. Christine, add to the conversation. What are our 3 key steps?
Thank you, Sarah. My first key step is very similar to what Shandy was speaking about, that there needs to be a clear understanding of the role of each of the individuals involved in the collaboration. So typically there would be a contact on the academic side, such as a faculty mentor, and then another contact on the healthcare facility side, which we would call a practice mentor. Usually there's a lot of extraneous people on each of those sides, but those are the 2 primary contacts. And so it's important that there's some shared understanding of what each of those people is going to be responsible for, and really what the expectations are for the student or intern that's placed on site. Another key piece is that there are documented requirements for the student participation. So that, you know, we're not figuring this out live time, that going into a placement, both the student and the practice mentor are aware of what needs to be completed, what the student needs to be exposed to or observed during their time there. More recently, we've seen a trend of employees who are, you know, already working in the field, being sponsored to come to an academic setting for a more advanced degree. And that presents its own set of challenges in terms of what's required on the academic side. So, you know, you're coming back to school for the first time in 15 years, what sort of documentation is needed? So there needs to be some clarity for each of those pieces. And then the last key step is that those relationships between the academic partners and the partners at the facility level exist before there's a problem. So, you know, it's not that you have a 1 second interaction to place the student and there's no communication before or after. Really, it's important that there's some trust and some professional connection that exists over time.
Couldn't have said it better, especially that level of trust. We know that with these steps can come some challenges. So we'll start back again with Shandy. Talk to us about each of those key steps that you discussed. What are some of the core challenges to taking those steps as an individual or as an agency?
So first, I would say we just have to remember that making assumptions is human nature. We always do it. And so constant communication is really critical. One thing we encountered is our hospital partners have regularly worked with our school nursing.
I'm sorry, Shandy, your microphone's not up. Could you turn it up just a little bit?
Sure. Can you hear me now?
Oh, perfect. Thank you so much.
Okay.
I know you have such great information for us. Please.
Sure. Sorry about that. So one thing I can say is that communication is critical. And one thing that we learned on our end is that our Hospital partners often work with our School of Nursing or our School of Medicine. And so they're used to those students already going through the process early on in their training to have simple things like a tuberculosis test done because they have patient interaction. Our public health students typically don't have patient interaction in that way, so it's not built into our regular curriculum to have student fees added on to do things like TB testing. It seems like such a simple thing, but we discovered this pretty close to the start of the semester, and so we had to kind of scramble at the end. And so now we know to think about those like basic management hiring practices that we might see on the academic side, might see on the hospital side, that we need to make sure that we're following. And then also we need to make sure we set that timeline as we talk about a return on investment. I talked about that a little bit in the first question. So that return on investment might take some time, but we need to make sure that we have that communication so that they don't get frustrated if they don't have an immediate return on investment. And then again, staff turnover is true in every project we ever see, including collaborations on the academic side and the hospital side. We know a lot of the academic partners typically stay for an entire academic year. They might switch over at a semester end. They're pretty stable, but it's not guaranteed. And same thing on the hospital side. We just see, hospital turnover as well. So we need to make sure what's the plan B if we have faculty turnover, and what's the plan B if we have hospital turnover.
Letty, could you continue the conversation for us?
Absolutely. So again, to put it in context, the three challenges that I have outlined here are all related to the process by which a university would submit their materials to be deemed as being academically aligned with APIC's curriculum guidelines. So I just kind of want to talk through what that process is, because again, it addresses the challenges that I've outlined here. So I mentioned in the previous question that we created a template. And so one of the things, and this goes to that sort of the first and the third challenges, is create a timeline, because as part of the process of by which you will submit materials is we are asking universities to submit materials for the faculty that are teaching the courses, the outlines of the courses, descriptions, because we really want to make sure that we're understanding the content that is covered. And so knowing who to contact, because one of the things, again, that I'd mentioned about making this process easy is that we are not dictating to anyone, you must have a course offered in this school or that school. We just cared that the content is offered. So you may have a contact in the public health school, for example, on a particular course. You may have a contact in the School of Nursing. And so understanding who to go to collect that information will just help the process that much easier and go that much quicker, so that you're prepared when those materials are due to submit to APIC.
Very nice, Letty. Okay, Christine, carry on the conversation, please.
Thank you. I certainly felt Shandy's comment about staff turnover. That is definitely almost a guaranteed that as soon as you have everything lined up, someone else moves on. But I do think it's really important to manage expectations, both of, what challenges are going to be, what is reasonable, efficient, and effective. So sometimes students or their practice mentor have fabulous ideas for projects or what they want the student exposed to during their placement. But they're projects that could take 2 years to complete when the student is there for a semester. And there's lots of other expectations that, with clear communication on the front end, helps to sort of avoid some disappointments or some confusion about what the plan moving forward is. The other thing is that onboarding steps for healthcare facilities and also admission criteria for students coming into an academic program seem to change more frequently than the weather. It's difficult to find written guidance because those steps are constantly changing. And so that's definitely a challenge and a source of frustration. And then the last core challenge is that leadership or mentors struggle with having the bandwidth for non-essential interactions and communications. So when you're looking to establish professional connections or build those professional relationships ahead of time, we're all just trying to get day to day, through the day and put out whatever fires arise. And so finding the extra energy or motivation to build those interactions is sometimes difficult.
I think you guys hit the nail right on the head with some of these core challenges that might come about. But we don't like to end on a negative note. So let's talk about some of those solutions. So we'll start back with Shandy. For each of those core challenges that you brought up, discuss some possible solutions and ways to overcome them as individuals and agencies.
That's a great point. We definitely want to end on a positive note because this is a positive experience.
Shandy, I'm gonna stop you a minute there. Again, your volume, if you can turn it up a little bit for us so we can hear all the important things you have to say.
Is this better? Sorry, I think my audio
Thank
goes
you
into
so
a delay. Okay, great. So yes, so I want to end on a positive note. This has been a very positive experience overall, and we continue to expand here in Indianapolis. But I really want to, again, just emphasize that we need to regularly check in with our partners to see what's going well, what's not, what do we need to adjust. And just remember, just because it worked for one partner doesn't mean it will work for all partners. So just know you need to have that dedicated time for those check-ins with any partner that you have in the collaboration. And then strong project management to keep track of time to make sure tasks are met. A semester goes by very, very quickly. We need to make sure if a student ends up catching on, if they need some additional help, that we're with that student, that we can check in with that partner, that collaborator. And then also review the documented wins and losses for any kind of continual improvement. And I talked last time about marketing. We want to make sure we can grow the program. We're looking here in Indianapolis about maybe looking at long-term care settings next once we expand our hospital program a little bit more. So having those documented wins and explaining how we were able to tackle any obstacles we overcame will be a great talking point when we approach those long-term care setting partners.
Absolutely. Thank you for those. Letty.
I'm going to keep the positivity going. And I will I will start by saying this was such a passion project of mine. It's something that has been, we started in 2021. And it is something that I think we are going to see the impact for years to come. And it is really, really exciting to be part of building this curriculum from the ground up. And so a couple things that I will mention here is that we had a multidisciplinary group reviewing the content that went into our guidelines. So we had people with MPHs, we had people with nursing backgrounds, just from a variety of different educational experience and professional experience to make sure that we're really providing content that's relevant, that is going to, again, set our future workforce up for success after they graduate with either an undergraduate, a graduate, or a certificate in infection prevention and control. And so my first bullet there is sort of, tongue in cheek with the EASY program. I will say this, from what I have seen thus far, we did have some universities that were our first movers, if you will, that we wanted to test and make sure that what we were providing made sense. And so I say easy because it seems like a certificate program rather, seem to be the lowest hanging fruit, where you're taking materials in a lot of ways, content and courses that you already offer, and you're just repackaging them into a certificate program, and then demonstrating the value that that certificate program has with students who are taking the courses and that are quote unquote graduating with that certificate program. And so that is why I say, again, tongue in cheek, start with the easy first. Like I said at the very beginning, we really wanted to make this template and these guidelines easy. This is free. There's no charge to submit. We want as many universities as possible, again, to create that consistency about how we're preparing our students to be successful as careers in infection prevention and control. And so there will never be, and there is not a fee to submit. And APIC is here to help answer your questions. We want to be a partner. We want to make this process easy. We want to make sure that you are getting your questions answered ahead of time. And so, like I said, you can tell this is such a passion project of mine, and I am so excited to see this come to life.
I can hear your excitement, Letty, and we love good free resources, especially the good ones that APIC gives to us. So USF, Christine, talk to us about some possible solutions to those core challenges that you mentioned earlier.
there's definitely positive reinforcement built in as you watch students move through the process. So I don't have the same experiences as Letty, but I do get to see individual students be introduced to the profession and sort of develop a love for what it is we do day to day. So I can't stress enough the importance of those shared expectations that we talked about previously. And I think it's important to formalize those expectations, what the students' deliverables will be, what next steps look like, to have those documented so that when there's questions or challenges later, there's something to refer back to. And of course, those can always be revised as things develop, but it's important to have sort of a roadmap ahead of time for the individual students' development. In terms of building some of those professional relationships, that doesn't happen in an instant, and it's small steps over time to have some professional connection and trust between each other. Using virtual opportunities such as local chapter APIC meetings or existing shared events like professional conferences is always important. I do notice that over time you start seeing familiar faces, and it's much easier to reach out to establish a connection for a student placement where there's already some shared knowledge of each other. And so I think it's important to continue those informal networking opportunities.
We love an informal networking opportunity, and certainly our webinar provides that for us. We are going to continue on the conversation with Shandy, Letty, and Christine in our Q&A session. But right now we are going to talk about what our key takeaways were from this conversation. So Maddie took us through that current landscape of infection prevention and control in public health education. We talked about building IPC educational pathways, including the urgent need for structured IPC education, not only with Maddie's conversation, but with our subject matter panel. And we talked about some of the gaps in our current training models, as well as opportunities for public health programs to strengthen IPC expertise through collaboration, mentorship, and innovative learning approaches. So we certainly hit a lot of things in these 45 minutes that we have been together. Now, we will be hosting a part 2 of this, which is our workshop on May 16th. For those of you that have already registered, hopefully you've taken some really good notes and all of the things that were shared today, because we're going to use that information as we then apply our systems approach handbook. If you can't join us for part 2 of the webinar, not a problem. We do have the handbook for you on that shared drive, but we hope that you would continue that collaborative conversation as we talk about that the academic to practice collaboration and overcoming those challenges. So stay tuned for that in the month of May. We'd also like you to continue the conversation with us by joining the community discussion board that NNPHI hosts. These are called the 3 learning pathways, and Patricia is going to put that into the chat for you for a quick link, as well as a monthly webinar series, Advancing Infection Prevention and Control, that NNPHI also hosts for us. We want the conversation to continue as our subject matters talked about. That is really those informal networking opportunities, and certainly these provide some of those outlets for you. So that we can keep the conversation going in a very natural and open and informal way, we are going to stop the recording for the Q&A session. Hopefully you've put a few questions in the Q&A box, and in a moment, we're going to stop the recording to get to all of your questions. But before we stop the recording, we would love your feedback. Feedback is a gift. It helps us improve. It helps us to continue that conversation. So in the chat, the evaluation link is there. There is a QR code on top of your screen as well. And if that doesn't please you, at the end of this webinar, you will get an email with the link to the evaluation. 3 different ways to share your opinion with us and help us to improve. So at this point, I'd like to thank you for joining us. We appreciate all you are doing in the infection prevention and control space, as well as all you do for us and public health and keeping our community safe. We are entirely grateful for you. At this point, we are going to stop the recording, but we're still going to be on to hear all of those beautiful questions that you might have.